So again, in summary, from my experience, having attended and graduated from 3 different accredited graduate doctorate level programs, naturopathic medicine really provided the best education for the treatment and understanding of infectious diseases. As I said before, I consider this to be a legitimate tragedy that medical schools are not really preparing students for their roles as clinicians, but rather preparing them to take exams and then preparing them to work in medical residency programs. As a result, from the best I can tell, medical students and residents actually learn very little about infectious diseases, practically zero regarding vaccines, a little bit more perhaps about antiviral drugs, but they are taught nothing other than ridicule about clinical nutrition, and they learn absolutely nothing about higher level integrative nutrition and functional nutrition, such as I'm discussing in this series of videos and also, of course, in my books. So this ultimately becomes the perfect formula for producing arrogant professionals that know nothing other than how to endorse and rely completely on vaccines and antiviral drugs while kind of scoffing and belittling other options that they haven't even been trained in. So it's a kind of a dangerous educational formula. Let's look at some data that substantiates what I just said. So here's an article published in Journal of Public Health, Practice and Management 2013. And ultimately what this article shows is that medical resident physicians are undertrained in critical aspects of what they discuss here as quote-unquote vaccine safety. So you can see what I highlighted here. 20% of the residents in either pediatrics or family medicine reported not learning about vaccine safety communication in their residency programs. So what is meant here by vaccine safety communication actually has nothing to do with helping patients navigate this information. What this has to do with is convincing people to receive vaccines. This really doesn't have to do with patient care other than convincing people to overcome their so-called vaccine hesitancy and increase their uptake and therefore the sales of vaccines. So indirectly, what this research shows is that physicians are not being trained in the proper administration of vaccines. And you can see the conclusion here. And unfortunately, I have to categorize this type of research as being somewhat imbecilic because what should be focused on in educational research such as this is the proper education of students and residents, not simply training these doctors to be salesmen and saleswomen for the vaccine industry. Let's look at another study. So again, this one was published in 2013. Let's look at this study published in 2014. You'll see it's actually quite similar. Most pediatric residency programs surveyed do not include formal training on vaccine safety, yet such training is supported by pediatric residency program directors as a priority for pediatric residents. Why? Because these people are going to go on to have their careers largely center around the sales and use of vaccines. So, I think that the main priority of medical training, whether as medical students or in medical residency programs, the main priority should be safe and effective and cost-effective and ethical treatment of our patients. I think that's the big and primary responsibility. Not being trained in how to sell vaccines, which is basically what's happening. And what they call here vaccine safety really doesn't have to do with safety for patients. What's being communicated in these programs, as you can see also on the following article that I'll look at in a little bit more detail, what's being communicated in these so-called vaccine safety education programs is how to overcome doubt for the goal of selling and promoting vaccine usage. So here, for example, let's look at this study published in 2015 in a journal called Current Drug Safety, teaching vaccine safety communication to medical students and health professionals. So again, what I really think is the biggest point to understand about what these articles are saying is that medical students and residents are untrained in the proper and ethical use of vaccines, and when they are trained, the conversation around their so-called training is this so-called vaccine safety education, which ultimately becomes nothing more than a sales pitch. So let's look closely at what's stated in this article, again from 2015. In many medical school curricula in German-speaking countries, the subject of vaccines has been entirely omitted or is regarded as a minor subtopic. During the studies, that is, medical school and residency, most medical school curricula in German-speaking countries do not offer obligatory courses and/or hands-on training in vaccinology and vaccinations. The authors go on to state, even during postgraduate training programs in pediatrics, which are largely hospital-based, vaccinations are rarely a topic. So you have to appreciate and perhaps be stunned by what's being stated here. Medical students and medical residents, generally speaking, are not being educated properly about vaccines at all, even though their careers depend on the sales of vaccines, especially in the practice of pediatrics. So let's take a look at a few more details from this study. What's stated here is, once established, good communication practices should usually prevail. Again, we have to distinguish between two types of good communication. One is authentic, clear, honest, ethical communication, where patients are informed of the potential risks and benefits of each individual treatment. What's being discussed here under the umbrella or the disguise of good communication and vaccine safety is nothing more than a sales pitch on how to overcome vaccine hesitancy and overcome the questions that parents have about the proper utilization of vaccines, including what does the research actually show. So again, vaccine safety communication is being kind of a code phrase or code term for teaching medical students and residents to become ambassadors of the vaccine industry and promoting sales and uptake of vaccines. So let's conclude based on these three studies, and of course another mountain of practical experience that we have, doctors and residents are not being properly educated about the true nature of vaccines. Likewise, they are not being trained at all in basic nutrition, let alone interventional nutrition, and then certainly not integrative and functional nutrition such as I discuss. And this is well established. I'll just show you a good survey of the literature here. Let's look at this article from 2018. Most medical schools and residency programs do not offer any organized training whatsoever in nutrition or lifestyle medicine. The authors go on to describe what they consider to be an absolute need for drastic reform in the U.S. medical education system. Well, that's not going to happen because medical education isn't designed to teach doctors and residents about nutrition nor about lifestyle medicine. The practice of medicine is simply that. It is the practice of the distribution of medicine. We all like to think of it in terms of patient care, but patient care is very different from the practice of medicine, even though I'm sure most people don't want to hear it stated as such. If patient care were the priority of medicine, then of course we would learn about nutrition, we would learn about lifestyle, we would learn about counseling people, not simply drugging them when they come in with a self-report of depression, but we would learn about kind of the existential and social basis for depression, rather than simply assuming it's a neurotransmitter imbalance that is best managed through the use of pharmaceutical drugs. But before I digress too much, let's look at some more research here. This article comes from the journal Family Medicine. This was published in 2017. Medical students felt nutrition was poorly integrated into the curriculum. They witnessed little nutrition counseling during shadowing experiences in hospitals and clinics, and the nutrition information that was imparted was often outdated or incorrect. Medical students and physicians agreed that the nutrition education currently provided in medical school is inadequate. So you're going to see that this is a well-established concept that medical education does not include any instruction in nutrition at any level, basic level, clinical level, or integrative functional level. It's just not happening. And this has been going on for decades and decades, and it's not going to change because the intention of medical school is not to train people in the practice of nutrition.